Hi, welcome to Steps to Strides with me, Connor Ratcliffe, and we're back in the garage gym today looking at some potential loading strategies for our tibialis posterior. Today's exercise is resistance band, plantarflexion, inversion. So let's take a look at it. So first things first, we want to get our band placement underneath forefoot, and then the other consideration is where we're holding our band. So if I hold it out to my right, then I'll get more resistance on inversion. So this essentially makes it a bit harder. If I hold it here, it's a bit less biased in that frontal plane, so I get slightly less resistance into inversion. So that's consideration number one. The other consideration here is our knee position. So like in some of our other videos, you'll see the more flexion we put the knee into, the more actively insufficient we make gastrocnemius. And that's relevant for tibialis posterior because its sagittal plane action is plantarflexion. So the more we flex the knee with this exercise, the more the tibialis posterior and its other plantar flexor friends will have to work a little bit harder in the sagittal plane. So it takes away one of your big powerful plantar flexors, which from sort of a force redistribution perspective and concept means that everything else that's remaining has to work a little bit harder. So this means the sagittal plane action gets a bit tougher for everything else, including tibialis posterior, which is our target structure for this exercise. The next consideration for this is our start position and the range of motion. So we can work through full arc range of motion with this, and this is why the non-weight bearing version of loading for tibialis posterior is quite nice, because you can be very specific depending on what you want your patient to do, what their tolerance is, and then that has built-in kind of progression essentially. So if we want to work through full arc range of motion, then we're going to dorsiflex, pull the foot up is what I'll say to patients as our cue, and we're going to turn the foot out. So we're going to dorsiflex and evert, and that becomes our start position. And then what I'm going to do is plantarflex and invert. So that works through the full arc range of motion. We're still going to cue our typical 1, 2, 3 second tempo. So 1 concentric, 2 isometric, 3 eccentric, nice and slow on the way back. And the cue that I'll give patients is push down and in. And it's the in bit that's important in this instance that differentiates it from just being a plantar flexor or gastroc exercise, because tibialis posterior plantar flexes and inverts. Now, if we've got patients who struggle with that, because it's a multi-planar movement, then what we can do is we can just isolate the frontal plane. But what matters here is that we consider our sagittal plane start position, which is a mouthful, isn't it? That's what students will say to me anyway. So if we start in a dorsiflex position like this and turn the foot in against resistance, if that feels a bit easy, as I say, I can move my band to add more resistance. Now this biases towards tibialis anterior a little bit more, which in this particular video isn't really what I'm trying to target. So what I need to cue my patient to do is push down. So push the foot down, and that becomes our start position. And now when I turn the foot in or invert, now this biases more towards tibialis posterior because I'm putting it into that plantar flex position to begin with, and then just focusing on the frontal plane range of motion. Now again, the nice thing with non-weight bearing resistance band work is that you can be really specific. So when I isolate just frontal plane inversion, we can do that from neutral to inverted. We can do that from everted to neutral, or we can work through the full frontal plane arc range of motion. So everted all the way through into inverted. So just like our full arc range of motion, where we come up and out, dorsiflex evert, and go down and in, plantarflex invert, we can modify the range of motion very specifically to our patient's tolerance, and then use increased reps and then increased range of motion as progressions within this. And again, it has built-in progression because we can increase the weight of the resistance band. So I think non-weight bearing exercises are often deceptively simple, but you can have quite a lot of specificity with it, and there are considerations that you should be making when you're prescribing this, and that should be interlinked with your assessment. The other benefit to this is that there's no real load over forefoot and there's no demand through metatarsophalangeal joints. So if we have patients with intolerance or concurrent pathology where they've got pain over forefoot, this is a nice option. It means that we can still load our target structure of tibialis posterior, but we don't have to worry about aggravating or exacerbating other symptoms over forefoot or within metatarsophalangeal joints. So let's have a look at this one more time with our 1, 2, 3 second tempo, because the eccentric bias is really important pretty much all of the time because of the tissue change effects that you get, but specifically for tibialis posterior, because it's that eccentric phase of contraction that we decelerate pronation or the frontal plane eversion, which is usually what we're a bit more worried about with tibialis posterior than its sagittal plane plantarflexion action. So if we want to work through full arc, then we'll come into dorsiflexion eversion or up and out for our verbal augmented cues to patient, and then we're going to plantarflex, invert, push down and in. Nice and slow on the way back up, and push down and in. Perfect. Now if we've got patients who are struggling with that, then what we're going to do is push foot down, make sure our knee flexion's in an appropriate position, just depending on how much we want to remove gastrocnemius from this and put a bit more pressure through tibialis posterior. But when we're pushing foot down and just working through frontal plane, the knee position actually matters a little bit less because we're kind of taking plantarflexion and the sagittal plane out of this anyway. And then we're going to work through our range of motion. And if we want more resistance, then we can move the band out to the side, and that makes it quite a lot trickier. And again, very specifically cueing neutral to inverted, or all the way out everted, to all the way in inverted. Nice and slow through eccentric and back in. And that is our resistance band plantarflexion inversion for tibialis posterior.